Assalamu alaikum, this is Zakria. I will explain the anastomosis around the knee. First, let's understand the structures in front of us. So if we say that this is the lower part of the femur, this is the tibia, and this is the fibula. To start with the anastomosis, first we will draw the femoral artery. The femoral artery then will complete to become the popliteal artery. Then the popliteal artery will continue to become the anterior and posterior tibial arteries. Another thing we need to know is the circumflex lateral artery that comes from the profunda femoris artery. A branch that will participate in the anastomosis comes out from the femoral artery, and we will call it the descending genicular branch. Another branch is the descending branch from the lateral circumflex artery. So we have the descending genicular branch of the femoral artery and the descending branch of the lateral circumflex artery. So what are the branches of the popliteal artery? We have four. First two are the superior and inferior medial genicular branches. The other two are the superior and inferior lateral genicular branches. So what are the branches of the tibial arteries? For the anterior tibial artery, we'll have anterior and posterior tibial recurrent arteries. The last branch will come from the posterior tibial artery, and we'll call it circumflex fibular artery. Now, who will anastomose with who? Let's start with the genicular branches. The superior medial and inferior medial genicular branches will anastomose with each other, and the superior lateral and inferior lateral genicular branches will anastomose with each other. The descending genicular branch will anastomose with the superior medial genicular. The descending branch will anastomose with the superior lateral genicular. Circumflex fibular artery will anastomose with the inferior lateral genicular. The posterior recurrent tibial artery will anastomose again with the inferior lateral genicular. And lastly, the anterior recurrent tibial artery will anastomose with the inferior medial genicular. Now let's do the anastomosis again. The superior medial genicular and inferior medial genicular will anastomose together. The superior lateral and inferior lateral genicular. Descending genicular branch will anastomose with the superior medial genicular. Descending branch of the lateral circumflex will anastomose with the superior lateral genicular. Circumflex fibular will anastomose with the inferior lateral genicular. Posterior recurrent tibial will anastomose with the inferior lateral genicular, and the anterior recurrent tibial will anastomose with the inferior medial genicular.